Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with Dr. Vasken Artinian. Dr. Artinian is a board certified in sleep medicine. Dr. Artinian, we talked in the first segment about sleep apnea. I want to ask you about narcolepsy. What is it?
Well, narcolepsy is classified as a neurologic disorder. In narcolepsy, we have a neurologic problem that would manifest in disrupting the sleep-wake cycle of an individual. And in common words, typically narcolepsy patients will complain of excessive daytime sleepiness. They'll be very much sleepy, and they may have another condition we would call sleep attacks. They would fall asleep at times that's not really appropriate. A lot of narcoleptic patients, they will fall asleep at work or in classroom, or even while talking to somebody. These are what we call sleep attacks.
Well, what are the symptoms other than just a sleep attack, and does the person know that they're falling asleep?
Typically, the most common, just like what I said, the most common symptom is sleepiness, and that's present in almost all narcoleptics. Now, there are other symptoms that I would like to mention, which include cataplexy. Cataplexy is a condition where the individual experiences muscle weakness and paralysis, and it's usually associated with intense emotions, such as somebody going through fear or happiness or anger. Typically, we see it with laughing. You know, individual was laughing. Next thing, he will experience muscle weakness, and it will typically occur in the lower extremities, and sometimes it can affect different muscle groups, such as the muscles of the face and the eye. This is what we call cataplexy, which is quite specific for narcolepsy. I would like also to mention two other symptoms, which is sleep paralysis and hallucinations. Sleep paralysis and hallucination can occur while going to sleep, and they can also occur when you're waking up from sleep. These are basically the most four common symptoms that we see with narcolepsy, which include, in summarizing things, it include sleepiness, cataplexy, hallucinations, and sleep paralysis.
So I'm always interested in, like in retrospect, once you've diagnosed people, they know what it is, but do they just come in and say to you, I don't know what's going on?
They will say that they're very much sleepy. They would know that they would fall asleep in situations that's quite inappropriate.
Okay,
Yep.
and it's what actually causes it?
Well, there are several mechanisms explaining narcolepsy. The most accepted theory nowadays is the absence of a chemical, a neurotransmitter in the brain called hypocretin. Hypocretin is a neurotransmitter that's involved in keeping somebody awake. In the absence of that neurotransmitter, the mechanisms that cause sleepiness would overcome the mechanisms that will cause alertness or awakeness. And as a result, you'll see that disturbance between wakefulness and sleepiness. And ultimately, sleepiness would win. And as a result, these individuals will experience a lot of hypersomnia.
Wow, that's amazing. How do you diagnose and treat that?
Well, first, again, you know, we take a good history. And first, we build a good clinical suspicion based on the history or the symptoms that the patient would present. And the second step will be to take the patient to the sleep center, to the sleep lab, and we undertake two tests. The first test is a polysomnogram, and the second test is a MSLT. Now, what's important in narcolepsy is the second test, which is MSLT. MSLT, basically, it's a nap test, where the individual is given around 4 to 5 naps, and we're looking for specific abnormalities in that test. Now, narcoleptic patients, typically, they fall asleep easily. They have a very short sleep latency, okay? And anytime we have a mean sleep latency of less than 8 minutes, that's typical of narcoleptic patients. We're also looking for REM onset sleep. Usually when you go to sleep, you don't go into REM immediately, but narcoleptics, they do. Anytime there's 2 or more REM onset sleep, it's more and more suggestive of narcolepsy. So we're looking for specific abnormalities along with the appropriate clinical history and abnormalities in the MSLT that would favor the diagnosis of narcolepsy.
Can you treat it once you diagnose it?
Absolutely. We cannot cure narcolepsy, but there is adequate treatment nowadays that can control the symptoms. I would like to mention two FDA-approved medication for treatment of narcolepsy. The first medication is modafinil, also known as Provigil. And the second medication is sodium oxybate, which is Xyrem. The FDA has approved Xyrem, which is the second drug. Xyrem is approved for treatment of narcolepsy with cataplexy. Now, we have also historically other stimulant medications, such as amphetamine-like substances and drugs that we use usually to stimulate patients and treat their hypersomnia. Whereas the treatment of cataplexy is mainly through the use of antidepressant medications such as tricyclics and SSRIs.
Wow, that's very, very interesting. We're going to take a break, and we're actually going to go to the Sleep Center for a little while, and then we'll come back and talk some more.
Okay.